Today is the opening day of baseball for many teams around the country, and opening day in baseball is always a historic day. This one particularly so. It is a historic day because for the first time in Major League Baseball history, smokeless tobacco, also known as chewing tobacco, will be barred from the field. No players will use chewing tobacco on the field, in the clubhouses, in interviews, anywhere in the park. And that is profoundly significant and historic because for the first time in baseball history, players who are idolized by young people will no longer be setting an example for them of using chewing tobacco that can cause cancer and all kinds of other diseases. Why is that important? The rise of chewing tobacco use among young people is especially alarming as a matter of public health. The rate is now 15% among high school students, staggeringly high, considering where it was just a few short years ago. As a matter of fact, the rate of chewing tobacco use is 1/3 higher now than it was just 5 or 6 years ago. And so what we're seeing is a rising use of chewing tobacco and smokeless tobacco, partly because it has been made more acceptable by Major League Baseball. And so this voluntary agreement, I stress it is a voluntary agreement, is profoundly significant because it will mean an end to chewing tobacco on the field, in clubhouses, in interviews, and also the carrying of tins in back pockets that makes it look cool and hip to young people that admire and even idolize Major League Baseball players. That's a great step in the right direction, the result of a letter that my colleagues and I, other senators and I, wrote to Major League Baseball back in October, right before the World Series. The other development that is profoundly important is that the CDC has released ads that have shown now for about 2 to 3 weeks, ads that really try to counter the massive spending campaign that relentlessly Big Tobacco has conducted year after year. Last year it spent $10.5 billion trying to attract kids to smoke, trying to lure them into lifetimes of disease and addiction. That amount of money cannot be matched, but these ads have an effect. And here's the really significant point. In the 2 weeks that the ads have shown, there have been sharp increases in the numbers of people calling the quit line. This federal quit line can be reached at 1-800-QUIT-NOW, and the numbers of people calling that line in the 2 weeks after the ads began showing went from about 13,000 to 34,000. So the ads work. And that's why, in a letter that I've written with 5 of my colleagues to the head of the Senate Budget Committee, I've called for an increase in funding on these ads. The ads will end, unfortunately, after just 12 weeks. The ads will be over in another 9 weeks. They need to be sustained. And the budgets for doing these ads need to be increased. And so I am calling on my colleagues in the Senate, as well as the President, to increase funding for these ads so that their effect can be sustained and increased, and that requires money to keep them on the air. And I'm going to ask others who are here, I guess maybe we should have all the speakers and then show the ads, or would you like, yeah, why don't we have the speakers and then show the ads? Pat, if you would please say a few words.
My name's
Jeff and John.
My name's Pat Checco. I'm chair of the Match Coalition. We're delighted to be here today with Senator Blumenthal. I'd like to first address the snuff and snus issue quickly. I'm old enough to remember Jimmy Fox and how he always looked like this on first base because he was chewing tobacco. The kids are going to chewing tobacco for two reasons. They think it's more glamorous, but also it's a heck of a lot cheaper than cigarettes. But I'd really like to address the ads. The ads represent the First Amendment rights of the people who know what tobacco does, and they are intended to increase people trying to stop. In Connecticut, our quit line is supported only by funds that come through our designated tobacco and health trust fund. So it is really important that we continue to have that money available because this is the only free source of counseling and NRT for individuals who really want to stop, and over 75% of smokers do. So we hope that showing the real face of tobacco has an effect not only on the kids not starting, but on those who are smokers trying yet again to stop this terrible affliction.
Thank you. Why don't we go to Jeff? You know, just so people understand what's at stake here, the costs of smoking are in the billions of dollars, probably about $193 billion every year. In healthcare costs alone, $93 billion. 440 deaths every year. And of course, smokeless tobacco causes cancer of the throat, mouth, esophagus, lungs, pancreas, which is one of the most deadly, as well as gum disease, heart disease, cardiovascular disease. So these are products that cause death and disease.
Thank you. My name is Jeff Seyler. I'm the CEO of the American Lung Association of the Northeast. And first, we really want to commend and thank Senator Blumenthal, who's been a true public health advocate for several years, going on decades, Senator. And we really couldn't make these strides without you. And I think it is so important that we're gathering today to really highlight certainly the Major League Baseball strides, which I think show the trends that are happening in our society, and that's been a long fought effort. And all of us here, including Senator Blumenthal and many others, have certainly worked to that. But that's a major societal benefit, there's no doubt. And as well as the ads that are going to be shown from the CDC. They're very powerful, very hard to watch at times, but this kind of graphic display is needed to combat the really devastating effects of tobacco use. Senator Blumenthal and Pat shared some stats, and I'll share another one, that the tobacco industry every hour in this country spends $1 million on tobacco advertising. And we need to have some counterweight. There needs to be some voice for people who are smoking and don't have millions of dollars to spend in promoting tobacco products, and this is part of that. So the American Lung Association certainly joins with our colleagues and Senator Blumenthal in calling for increased funding for these ads. Thank you.
Thank you, Senator. And my name is John Bailey. I'm with the American Heart Association, and I want to just echo what Pat and Jeff have said. Tobacco control is a very important issue to the American Heart Association, and we want to thank the Senator for being a leader here in Connecticut when he was the Attorney General and really blazing a path with regards to addressing tobacco control issues. And now today, taking his experience from being the Attorney General in Connecticut and really leading the way up down in DC. So thank you, Senator, and I guess now we'll be looking at the videos.